Good afternoon, everybody. Today is a fun session. It's relatively jam-packed. We are going to go over how to fill out our spreadsheet for the 1095s. Before we get into that, let's go ahead and talk about where we're going. And first, I want to thank you all for joining every Friday afternoon at 2 o'clock. It's becoming a bit of a routine. So thank you for ending your week with me. I hope it's been useful. We'll continue these as long as people keep showing up. So we're going to do just a super fast ACA review, a couple of quick definitions, some forms overview, and then we're going to get into the spreadsheet. But the main goal is to familiarize you with the spreadsheet and how to fill it out so that you have something to refer back to, something to look at. ACA reporting is absolutely upon us again. This year promises to be a bit more crazy than past years because it looks like we're not getting any sort of extension or deadline relief. This applies to everybody who's subject to pay or play. That's applicable large employers, 50 or more full-time equivalents on a control group basis, which includes all of your employees. Union employees do not get you away from this. They still count as your employees. So these employers that have to pay or play are subject to penalties if they don't offer minimum essential coverage to all full-time employees or not offering minimum value coverage that is affordable to their employees. The penalties, for those of you who are old timers like me, have gone up quite a bit. We're looking at $2,700 if an employer fails to offer any coverage minus the applicable waiver. And if they offer coverage, but it's either not affordable or not minimum value, so they offer at least a minimum essential coverage plan, or they offer a plan that is unaffordable, they pay a $4,060 penalty for that employee that gets a subsidy. Only for those employees who get a subsidy, though. Affordable isn't how I define affordable. It's probably not how you define affordable, and it's certainly not how most employees define affordable. It's how the IRS defines affordable. So affordable means 9.83% of earnings. It's household income is what's counted, but employers can only rely on a couple of safe harbors. They can rely on W-2 box 1, they can rely on the hourly rate, and they can rely on an annual salary. I'm going to use some acronyms throughout the process. MEC is minimum essential coverage. That's really anything that gives any sort of medical plan coverage qualifies as a MEC plan. Minimum value is a plan that covers 60% of actuarial value, meaning if you punch in everything the plan covers, it's expected that it'll cover 60% of total expenses for people on the plan. So there are also a ton of forms. For this webinar, we're going to be focusing specifically on the 1095Cs, but there are 1094s and 1095s, A's, B's, and C's. The A form is issued by the marketplace. So this is if you go to a state-based or a federally facilitated marketplace and you get an individual plan through there, you're going to get an A form that says that you got that. The B form comes from your coverage provider. So that is going to be your insurance company or your self-employed employer. And your C form is always going to be from the employer. It's not going to come from the health insurance carrier. It's not going to come from the marketplace. The 1094 version of each of those forms is the fax cover letter, basically, that goes to the IRS. The 1095 is the copy that goes to each eligible or enrolled individual. All of these forms are used to reconcile taxes. So each of these forms, for those of you who've seen any sort of penalty notices, every one of these forms has a penalty associated for not filing. So what do? These plans, the first form, the A form, this is used to show if somebody was enrolled in minimum essential coverage, and it proves that they got a subsidy if they got one. It shows how much it was, so we can tell if somebody got the subsidy. For employers, you're not going to issue these forms, but if one of your employees gets one, it may trigger penalty liability for you. So that's why this form is relevant. For the B form, this is for self-insured employers or fully insured carriers. These forms are issued by the coverage provider. So everybody who's covered under a health plan, whether they're small group, large group, or individual coverage, will get a B form so they can show that they're compliant with the individual mandate. The individual mandate still exists, it's just that the penalty is $0. So everybody will still get one of these forms. Here in New Jersey, this form also gets filed with the state or an equivalent form for all self-funded groups, and all fully insured people should be done by the carrier. But for self-funded employers, this data has to go to the state of New Jersey as well. And then the 1095-C is the big form we're going to talk about today. What this does is it reconciles what the employer offered the employee. Each full-time eligible employee gets one of these if they work for a large employer. So if you work for a small employer, you won't get one of these. But if you work for a large employer and you're full-time and entitled to coverage under the ACA, not the employer's rules, then you would get one of these forms. This verifies what the employer offered to the employee and how much it was going to cost. What it's going to cost isn't necessarily what the employee paid, it's what the lowest price plan would have cost for the employee for any given month if they were enrolled as a single employee. And then it shows if the employer is claiming a safe harbor. And that safe harbor is if the employer knows that their contribution is affordable, based on that definition we talked about before, then the employer is saying, I'm protected from any sort of penalty. If this employee got a subsidy, they weren't entitled to the subsidy, but you can't penalize me. So the B form and the C form, the cover page looks sort of similar. The 1094B, it's just got the file information and the number of forms. The C form has a bit more information on it. It's going to talk about who is in the control group. It's going to talk about how many forms are offered, who to contact with the employer. But we're going to focus really on the C form, or the 1095C. So this is from large employers to their eligible employees, and it tells the IRS what the employer did. It shows if they offered coverage, what kind of coverage they offered, how much it would cost the employee, and it shows enrollment for the employee, and if you're self-funded, it shows it for all the dependents as well. This form has changed a little bit over the years. This new 2021 version that's on the screen, you'll see if you're familiar with these forms, there's actually less information on page 1 than there used to be in terms of enrollment information for self-funded plans isn't listed on page 1 anymore. It's because there's more information in part 2, lines 15, 16, and 17 now include another line for the ICRA, and we'll talk about that as well. So who has to file these? The C forms are required to be filed by each applicable large employer member, and they each have to file on their own. So if you have a control group, let's say you have a chain of fast food restaurants and everyone is its own LLC, but together they are one control group. Let's say they're all owned by one person to make it easy. Each of those restaurants, each LLC files their own 1094C and their own 1095C, even if individually they're all below 50 full-time equivalents. As a control group, they would. So they each have to file on their own. Then we look at how many forms they're filing. If they're filing 250 or more forms, they have to file through the AIR system. There is a pending change on this. We're waiting to see what happens, but it's possible that this could drop down to 100 forms. There's a rule that seems to have gotten a fair amount of positive feedback. If that happens, employers with 100 or more forms are going to be required to file electronically. We are prepared for that. I can assure you that most employers are not and cannot do that on their own without some sort of a software service or a vendor to be able to do that. It takes a long time and some real IT expertise to set up the ability to electronically file these with the IRS. And then when you file electronically, the AIR system, which is the Affordable Care Act Information Returns, is what AIR stands for, that matches names with Social Security numbers with the Social Security Administration database. So that means that when we file electronically, if you've got a name that doesn't exactly match the social, we're going to have some more follow-up to do. And it's not an incredibly burdensome process, but we do have to follow up and correct those. And you do have to, as an employer, do everything you can to make sure it's correct. Every year up to now, we've gotten an extension on the deadline, and we've gotten good faith relief. We have no expectation that we're going to get an extension on the deadline or good faith relief as of right now. So this means that forms that were previously required to be handed out to the employee February 28th or March 2nd, depending on where the calendar fell, what day of the week it was, those have to be furnished with W-2s essentially, not together, stapled together, but on the same date as W-2s are available. January 31st, 2022 is when we expect to have to issue 1095Cs to employees. This is a huge change. Unlike W-2s, where your payroll system has been tracking it and it's basically a simplified one source of data form, 1095s, the C forms require information from payroll and they require information from your insurance provider, and then they have to be reconciled and put together. So this is not the kind of thing to wait too long for. The filing deadlines have never been extended really by default since really the first year they were extended, but February 28th, if you're filing on paper, they've got to be in the mail to the IRS. March 31st, they have to be filed electronically. But the real deadline here is January 31st, because everything has to be done in order to issue these forms to the employees. There's not much more in terms of the forms themselves that has to be done after you've created them to give them to the employees. If you are an employer in New Jersey with self-funded coverage, or you found out that maybe your insurance carrier, fully insured carrier, is not providing the forms not filing the forms on your behalf to the state, those forms are due on March 31st. Employers who use us for their 1095Cs or their 1095Bs, we include that electronic filing to the state as part of that process. In order for us to guarantee timely filing, our deadline is going to be January 10th. We're going to take your forms afterwards. We're going to take your spreadsheets afterwards, but we need them in early to guarantee timely filing. Everybody that comes in after that will go in line, and we will get through them as fast as we can. We pride ourselves on hitting these deadlines. We've got an incredible track record in the past. We intend to keep that up, but we're going to need your help because it's going to be a tighter turnaround time than before, and the good faith relief and the extensions are gone. So January 10th is when we want these things in-house here.